This conference will now be recorded. This conference will now be recorded.
Good morning to one and all present here. I am Mrs. Nirmala Fernandez, Assistant Professor in charge of Department of Nursing Education, along with my colleague Mr. Umesh Nandgaon, in charge of Department of Nursing Education, CAET Institute of Nursing Science, Belgaum. Welcome you. Once again, a very good morning to all. And I take privilege to welcome today to the national webinar on artificial intelligence in nursing. The resource person for today will be from Dr. Sudhir Reddy, Principal from CAET INS. The second resource person is Mr. Ravi Shankar Sankeshwar. He is the administrator in the KD Dr. Prabhakar Hospital. Will be introducing the AI in nursing. Dr. Sijila ma'am will be explaining about the application of artificial intelligence in nursing. And lastly, we have the third resource person, Dr. Ramesh C, Assistant Professor from Sri Ramachandra Institute, Future of Artificial Intelligence in Nursing. Artificial intelligence in healthcare. I request the delegates kindly mute so that it will cause. If anything is there during the session, kindly see that you all can put in the chat box. The registration is from the various part of the country. Almost 23 states have been registered. We have almost 300 plus registrations. And again, the delegates are joining still, but it's a time up, so we will start the session from Dr. Sudhir Reddy with the keynote address. So I take a privilege to introduce our eminent speaker for today is Dr. Sudhir Reddy, Principal of CAET INS Belgaum. Ma'am has completed UG from College of Nursing AFMC Pune 1992, PG from KL Institute of Nursing Sciences in OPG Nursing Belgaum in 2000, and ma'am has also completed MPhil from Manipal College of Nursing in 2006. Ma'am has completed PhD in Nursing in National Consortium for PhD in Nursing, Rajiv Gandhi University of Indian Nursing Council in 2014. Ma'am is nominated member of Standing Regulation Committee of International Confederation of Midwives, ICM, for Southeast Asia. Ma'am is also adjunct professor at Thomas Jefferson University, Philadelphia, USA. Participated as SOMI leader in exposure visit to Sweden in 2009. Ma'am is a former chapter secretary, SOMI, Karnataka, and former vice president of SOMI, India, former vice president, North Region, TNI, Karnataka State Branch. Part of many UGC, NAC, INC peer team visits for evaluation of universities. She is a master trainer for virtual capacity building program for midwifery faculty organized by INC and UNPFA, and also master trainer for helping babies breathe HBP program. Ma'am has many international exposure by attending the presenting in ICM conferences overseas at Durban, South Africa, Toronto, Canada, Hanoi, Vietnam, Telford, United Kingdom of Royal College of Midwives conferences. Good morning, ma'am. Ma'am, I welcome you. Ma'am, you can start with the keynote address.
Thank you, Nirmala. A very warm good morning to all of you across India. A special welcome to my Annie friends from the Annie group, the SOMI group, TNAI, all the faculty and students from different schools and colleges of nursing. I thank the Department of Nursing Education at Kale University's Institute of Nursing Sciences to enable us to do this long due webinar. It was a very challenging topic, a newly coming up topic, that is artificial intelligence in nursing. And when we were trying to look for resource persons, I said, I can't be a resource person. I have no knowledge about this. So we were looking at people across India who would deliver it. Then I met Mr. Ravi, a very good friend and IT person from our Kali Hospital. I had met him once in the airport, in the Hyderabad airport when I had gone for a Novotel Hotel Apollo conference. So he also had come there for the IT conference. So I said, yeah, he must be the right person. I requested him to please, focus on this issue for us. And then I got hold of Dr. Ramesh and Shija madam in some other webinar when I saw her touching this topic. So I said, okay, we have 3 people who will illuminate all of us regarding this very challenging topic coming into nursing everywhere. Whenever we look for courses abroad like Masters of Science, there's a huge demand for IT engineers to do their masters in big data, AI, and robotics. So I thought that why there is no scope like that for nurses. So I think there's a huge area where the nursing professionals can get into, right from developing a program, master's program in AI in nursing, get trained for it, and be the resource person for all of us across India. And because we are the people who are practicing nursing in the clinical area, so it's the clinical nursing staff, the ANMC periphery, the grassroots level workers who should tell us, look, this is what I want from nursing. Can you develop this AI management system for me? Because I can work in a better way. So this is like we are totally involved in it, and we must develop a curriculum for AI in nursing as a master's course. And all the IITs across India are looking for partnering with us. So some of us should take up leadership in getting this course started in India. And meanwhile, since I've been asked to deliberate on it, I do not have any presentation, and I will just try to start with, like, in today's ongoing efforts to find solutions for complex healthcare problems, this artificial intelligence is becoming more and more accepted method. Like AI and machine learning, that was one word which I forgot to mention. That's another big area which provide a lot of emphasis for healthcare in nursing. And if you actually see at what is AI, it is the theory and development of computer systems which are able to complete tasks that typically require human intelligence, such as visual perception, speech recognition, decision making, and language translation. I happened to visit Thomas Jefferson University, and I was amazed to see paperless wards. There are no case papers. I was trying to look at a patient history. There was nothing. So it's not that, they are. I think somebody is speaking in the background and disturbing us a lot. Can you find out that person and unmute him, Nimala? Ask the IT guy to do that. I think it is Panchalan Kharbikyu.
It was Ravishankar sir.
Yeah. He's going on talking and disturbing us. And so when I went there, it was not that it was all the junior nurses, the smart nurses, the more techno-savvy nurses who were managing the paperless wards. It was all the old matrons, old sisters who were of our age and bigger than our age who were managing all this. So that is what amazed me, that it is not difficult to get it into our system of healthcare. Can you unmute this guy, Vansalan Barbecue?
there is a last fact.
He is only going on talking. So what should I talk?
Do normal breathing.
Nirmala, what should I do?
Ma'am, 1 second. It's a request to the delegates, kindly mute so that
Please not
the speaker can speak.
go on talking.
Please mute.
Because from the nose, mouth and nose. Okay, ಅವಾಗ ನೀವು ಹಂಗ್ ಮಾಡೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ?
Ma'am, 1 second. Sorry for the inconvenience.
Next, mother's milk. ಮಗುವಿಗೆ ಎದೆಹಾಲು ಉಣಿಸು. ಅಥವಾ ಊಟನೇ ಎದೆಹಾಲು. ಈಗ ಒಂದೊಂದು ಕಲ್ಚರಲ್ ಪ್ರಾಕ್ಟೀಸಸ್ ಇರ್ತವೆ. ಜೇನುತುಪ್ಪ ಕುಡಿ ಹಾಕಿ.
I know what is happening, Nirmala. This is Jagdish who is the other workshop. This presentation is going on.
I'm not getting the IT person.
No, it is Jagdish who is presenting in the other workshop for ANMs which is going on. It is his voice. Okay, so back to AI in nursing. So preparing the nursing students and nurses for clinical practice in the age of artificial intelligence requires a huge balance between the current teaching methods and anticipating the future demands. And in the last 2 decades, lots and lots of accomplishments in nursing informatics has happened, and which can be leveraged to provide lot of curricular reform support for nurse educators. If it doesn't begin at us in the college, then it is not going to translate into the clinical practice. And why nurses should understand how AI is utilized in patient care. Some transformational uses of the technology include accelerating the innovations, lot of improvement in the decision making among the nurses, automating and speeding up the processes and saving overall costs. And in healthcare, if you look at AI, it is a potential solution for handling massive increases in the complex medical data, but only 15 to 20% of the end users are using it. And I know that the research cell at our university has a huge database which is in around 50 to 60 villages across Belgaum, from where they transfer all the data into the systems at the JNMC campus, and they manage the data management. We have special data management engineers who work on translating the data into research, and these research findings are published in journals like Lancet, New England Journal of Medicine, and also the evidence-based results are, published by the government of India, like use of misoprostol among ANMs to prevent PPH, using of the WHO labor care guide, and also into practice. So why I'm talking to you about all this, because I've seen it happen, how AI has helped us to manage the data across these villages in a very systematic manner without wasting time on manual re-entering the data, how quickly it is translated into evidence-based research, implemented in the government of India guidelines and also in the local labor rooms. So this is what we need, and unfortunately only 15 to 20% of end users are using it today to drive the quality patient care. And if you look at overall emphasis on AI in nursing, we have 8 areas where it can be used in decision making. Like most of the nurse managers, nurse leaders working in the clinical area know about the CDS, clinical decision support, which provides nurses with additional knowledge so that they can make decisions, create a lot of alerts about medication interactions, and determine the treatment options. It is also used in diagnosis, early detection of CAs. Yesterday I was attending a conference in Karad, and wonderfully they are using the Apple Ka app to detect breast cancer, which can be recharged and used at a time for 50 mothers in the community to find out the without fail with the use of AI the detection of CA breast among the huge female population in India. They are working with a US based company. So these are the examples which I'm seeing around me, so I thought I must tell. End of life care also has lots and lots of scope with the use of robots and AI to interact with the elderly to combat loneliness and social isolation, especially abroad. They are working on it. Here we have huge workforce of nurses, but then to orient them to these aspects of loneliness and social isolation is a challenge. And healthy living applications, we know so many apps are available for health applications which encourage healthier behavior and management of health conditions. Of course, in research, the sixth area which I try to learn is AI is used in drug research a lot. And preparations, AI can produce naturalistic simulations to prepare nurses for all kinds of scenarios. I am looking at this because we now, since Indian Nursing Council has brought up the new syllabus where a lot of simulation based learning is there, we need to work on it. And scenarios and simulation based learning is going to be the new challenge for all of us in mm, the teaching institutions. And lastly, I found out that treatment, nurses can gather a lot of information from AI systems to form a comprehensive care plan for their patients. So when you look at the future of AI in healthcare, people have identified it abroad, they're working on it, it's coming into India, and they are into a lot of advanced algorithms to ask the patient questions based on their answers. Robots are being used to draw blood, develop real-time nurse schedules, or check room availability for admitting patients. Otherwise, it's the nurse, you get a call from the admission counter, you have to give them information about the vacancy of rooms in emergency. Especially during COVID times, I faced it in my hospital because that system was not so much in situ. So these are the simplest things to the complex things which AI can surround us in future. It is already there among many of us working in corporate hospitals, but it will gradually seep into the healthcare system, and it should be brought to every employee by incorporating it in their workflow through processes and procedures, so that AI can amplify all functions within the organization. And why nurses? Nurses should be at the forefront of this transformational technology and empowerment throughout the implementation process. So it's there for all of us, how we take the challenge, the educators, the clinicians, the nurse practitioners, the students. It's a thought-provoking topic for all of us. And in the end, I would just like to say that AI can increase productivity and the efficiency of care delivery and allow the healthcare systems to provide more and better care to more people. It can help improve the experience of all of us. We need AI to help ourselves to execute our responsibilities in any area of administration, whether educational, clinical, research. Everywhere we need someone to help us. Who is there to help us? And thus it will improve the experience of all of us, enabling us to spend more time in direct patient care and also reduce burnout among us, isn't it? Most of us have become clerks, administrative clerks. I always say I am not an administrator, I'm a clerk. I have to check my mails, I have to do this, I have to develop protocols, I have to go for rounds, I have to see something is not working in OT. Why? So I think we need AI desperately. We need a very cascading system of delegating the work to both AI and other team leaders, so that AI seeps into the healthcare system and we have better healthcare delivery system in India. Thank you so much. Now we move on to the more technical sessions, and I look forward to listening to them as all of you are into it. I thank Annie and Somi and TNI for so much of interest. Like whole night I was getting messages individually to join, and I hope we satisfy all your inquisitiveness towards this topic. And thank you so much. A warm welcome again.
Thank you so much, ma'am. Ma'am, really this AI, when the topic has been, when we were just searching for the topic, we were getting so many articles. And in that, really it is that AI can help in the efficiency of healthcare delivery system. Thank you so much, ma'am. Moving on to the first session. The first resource person is Mr. Ravi Shankar Yam Sankesh. Second. Thank you.
Hello.
So 1 minute, I'll introduce.
Hello, Ravi sir. We'll introduce you.
Yeah.
Then you can start the session.
Yeah.
Page first.
क्या हुआ निर्मला?
Yes, ma'am. Yes.
Yeah. Don't worry, हो जाएगा आशा. निर्मला.
Yes, ma'am.
जब तक वो नहीं होता, shall I start reading about him so that we connect when it gets
Yes,
connected?
yes, ma'am. Yes, ma'am.
Yeah,
You can.
Ravi Shankar sir, a warm welcome to you. He's the administrator, information technology at our KLE's Dr. Prabhakar Kore Hospital in MRC Belgavi, which is a 2,400 bedded hospital with more than 283 ICU beds and a lot of satellite centers across rural areas of Belgaum. He's completed his Masters of Computer Application, around 22 years of experience in IT healthcare domain. He has leveraged experience as IT consultant, CIO in healthcare technology, both processes and innovations. Total 9 hospital implementations, he including international implementations. He does all the IT project execution with his great team here, IT project planning for healthcare, multi-specialty hospital industry. He is also responsible for adoption and implementation of Ayushman Bharat scheme in the hospital systems. He is a winner of the CIO Award 2018 in Best Adoption of Electronic Medical Records IT Healthcare Awards. He is the Best Newcomer and Best All-Rounder Award from Wipro Technology. He is the member of the team which got the Best Team Award for the fourth quarter for contributing in the successful implementation of project in Saudi German Hospital Jeddah for WHCIT in 2006-07, and he also got recognition for successfully implementing it. PAX Knowledge Transfer Expert Award from Wipro Limited. So he's lot of applause to him. We are lucky to have him at our hospital. I meet him on a daily basis to sort out many issues related to IT, which I'm learning because I'm new to the hospital field now, doing a dual role. So a warm welcome to you, Ravi Shankar sir, and over to you, sir. Thank you so much. Yes, Ravi.
Yeah.
So you
Good
can
morning,
continue.
madam. Good morning, one and all. Thanks for your warm welcome, madam. Now, my topic is introduction of artificial intelligence. Can you please enable the screen sharing? Hello.
I will do it, Ravi.
Yeah.
You're in the hospital?
Yeah, in the hospital.
Mm.
I am going to talk. Speak about introduction of artificial intelligence in the nursing practice. How we can adopt in my slide. What is artificial intelligence? Let us understand what is artificial intelligence. Artificial intelligence is an advanced branch of a computer science to perform the task that typically required by human intelligence based on the data analysis. AI is a broad category of emerging technologies that aim to investigate, learn intelligence from the various clinical systems and information sources. The technology helps not only making a decision, in some cases, even supplementing a human task. You start doing the automatically human task. The system will automatically start doing the human task. The goal of AI is to learn and adapt by providing responses and a prediction over time faster and more relevant decisions that human computing can do. Artificial intelligence is a healthcare in a various fields like What is the artificial intelligence? Let us understand this concept. I mean, we will not enter into the more of the definition or technical definitions kind of a thing. I mean, let us simplify the definition. What is the artificial intelligence? If you consider the automobile industry, they are already reached much advanced stage in the artificial intelligence. If you consider the example, if there are droplets of a water on the windshield of a car, automatically wipers will get on, and if the lights, fog lights or headlamps will get automatically on based on the natural light. If you consider artificial intelligence implementation at home, I mean, weather changing, warming, automatically AC on. Based on the voice recognition, automatically engine on. So these adoption of technology in the automobile industry went ahead like anything. And if you consider the healthcare, artificial intelligence in healthcare, various field like algorithm, radiology of a fact, like we are into the process of capturing so much of a data from radiology and cardiology. So what they are going to do with this data? How this artificial intelligence companies are going to use this data? So basically, they are going. I mean, everyone are crazy behind data nowadays. What we'll do with the huge data what we have? So how to utilize it? That is the subject of artificial intelligence. So we have n number of radiology images of brain scanning. Department of Computer Science is going to use the analytical skills, how the reports are going to generate. They are going to automate the process. Improvements in computing and powering the result, faster collection of a data. Data collection in healthcare allows the system to create a holistic view of a patient. Treatment, advanced treatment methods, improve communication between the doctors and the patient, enhance the healthcare outcome. What is this process is called? This process is called, in this process, data collection process, we are teaching a computer what we want in future. So how we are going to teach a computer? How we can teach a computer? What is our benefit? The initial data entry what we make is a very important aspect. This process is called, computer data entry from the various angles of the hospital. Okay. How artificial intelligence is partnering with the nursing to provide a care. Adoption of a best ERP. What is the ERP? Enterprises resource planning is a primary example for, as Madam said, like curriculum should be included in the nursing practices. Okay. I mean, based on the data entry, software can automate many things. For example, based on the patient registration, date after 30 days. Based on the patient registration date after 30 days, a system will automatically prompt like there is a follow-up date on a given day. For example, we receive not less than 1,200 patients per day, every day. So they will be just walking into the hospital, registering themselves, going to the various departments and taking the treatment. What is the role of a system in overall task? The patient should come after 30 days as a follow-up. On 28th day, system will start alerting a patient. You have a due of a follow-up on so and so day. Okay, as soon as doctors write a admission note to the patient, what will happen? Admission counter will get an alert in the system. We have sending so and so patient, so kindly admit. There is a small alert which will help the user who is sitting in the admission counter. And soon after admission, a SMS alert will be sent to the doctor. So this will help a doctor where his patient is admitted, because we are such a huge big hospital. It's very important to know to the doctor in which ward, which room the patient is admitted. So one SMS will be generated to the doctor saying that your referred patient is admitting in so and so ward. in which location. So this, and also if a patient is having some insurance kind of a thing, like cashless patient, automatic mail will be generated to the insurance company. So all this is part of a best ERP system. Okay. Implementing electronic health record. What are the benefits of adopting a electronic health record? So following, I mean, as I said, OPD visit, like follow up and revisit, electronic case sheet will help to review the patient record. Whenever a patient comes for the follow up, he will never, I mean, majority of times he'll never bring the what is his previous visit details and what earlier he has been prescribed. So once, as soon as we supply the patient number into the system, it is going to show, I mean, for what purpose he was earlier visited, what medication has been given. So doctor can change a minor modification and go ahead. So based on the admission, auto alert will be sent to the nursing counter. Here the part of the nursing will start. So as soon as admission will happen in the ward area, one alert will be sent to the floor supervisor as well as the nursing head of that particular floor. Like this so and so patient is coming for the admission, keep the bed ready. So that alert will help a nursing staff to keep the bed ready, and if any emergency patients, emergency alerts will be sent, so that ICU occupancy, they can make some homework kind of a thing, be ready what they should do. So drug management and the drug administration is a very vital and important role of a nursing duty. So whenever like patient admits in a ward, whenever there is a duty changeover, what previous staff has drug administration given, so next coming staff, next shift staff will come to know what already drugs have been given to the patient. So this will reduce the errors in the clinical area basically. And allergy alert. If a patient is allergic to the specific medicine, automatically when the patient is indented for such a medicine, it is going to, the system is going to prompt you like so and so medicine is allergic to the patient. So this is adoption of a nursing practice. Diet chart based on the comorbidity system. Like if a patient is a diabetic, in the kitchen there will be alert sent, like these are the comorbidities of the patient. If it is the diabetic diet should be sent for the so and so patient. In such a huge hospital like 2,400 bed hospital, manually doing all this stuff is humanly impossible. So where the system is going to play a very important role. Prescription alert. If the drugs are not meant for neonatology patients, if a neonatal patients are admitted, assume that that drug is not meant for, not supposed to be prescribed to the neonatal. So it will even stop the clinical errors, what it may happen. For example, if a medicine is not meant for a neonatal, when you go for indenting, it will alert you. This medicine is not, based on the age parameter, what it is admission counter is entered. Based on that age parameter, the system is going to alert you not to indent. This drug is not meant for a neonatal. So it is going to alert on so many errors of the practice, clinical practice. Hope everyone are with me. You're understanding?
Yes,
Hello?
sir. Yes, sir. Yes, sir.
Yes, sir.
Yeah. Now, widespread implementation of LIS as a artificial intelligence process. Nowadays, smart vacuum trainers have been introduced. Smart vacuum. What these smart vacuum trainers are going to do? It will automatically make a detect as and when the sample is drawn, whether that sample is enough to perform the test or not. So these are the smart vacuum trainers. For example, smartphone. See, it is going to predict what we are going to do. Smartphone. If I am typing something, what should be my next text? Automatically, it is going to scroll down the text. In the same way, smart vacuum trainers, which have been introduced in the healthcare industry, which will automatically, as soon as you put the sample, for example, CBC required a 4 ml of blood. If a sample put in that into the 2 ml, it is going to alert in a red color that this sample is not enough to perform this test. So which will help the nursing staff who is drawing the blood around the, to the bedside. Duplication of a test. Once the test is sent already, if a nursing staff want to, by mistakenly when duty changes, next duty nursing staff want to put an indent for the next same investigation for the next time, it's going to alert like this test already sent for the requisition. So this will educate the nursing staff. Lab rejection notification. So due to some reasons, maybe a lab rejected the sample, like the sample got hemolyzed, sample is not enough. So how the ward should come to know about this rejection? So whatever the rejection notification alerted by the lab, that pop-up will happen in the ward. Like so and so patient's sample what you sent is not enough. It got hemolyzed. Please resend the sample. So this communication gap can be reduced like anything. Adoption of a system. On the abnormal results of the lab, automatically alert will be sent to the treating doctor, and it will highlight in a red color so that treating doctor, nursing staff will come to know that these results are abnormal. Based on the report approval, immediately it is given a provisional report, can be viewed from the lab, ward itself. So other things like OT list confirmation, the OT schedule. OT schedule is a size of we hospital, we perform not less than 80 to 90 surgeries per day. But managing the list, creating a schedule is the biggest task. This list will be sent from the ward level. The OT will prioritize the list, and they will send the confirmed list at a speculated time, and that confirmed list is going to publish in the ward level, so that ward people will come to know when their patient will be taken for the OT and what preparation need to be done. A medicine indent alert. If a medicine is already given to the patient, it is going to automatically alert us, like this medicine already given, not to repeat the medicine. And many more things like consumption pattern, monthly maintenance figure, indent tracking. These all possible by the best adoption of a best ERP system. Some e-administration part is also involved. A duty roster is a very important role of the nursing management. So who is going to work on what time? So this duty roster will automatically integrate with your leave management as well as online training schedule and for the generation of the payslip. As soon as a part of e-administration, as soon as salary part completed, automatically a system will throw out on the employee portal what salary he is going to get, and even it is integrated with the biometric attendance. Online viewing of leave, an employee can post for his online leave. It is just to ease out the administration part. As a nursing administration will get an alert. So many nursing staff are on leave by posting the online leave management, online circulars. If any notification received, generated from the hospital administration, that notifications are available automatically on their desktop as well as mobile phone. Improvement in natural language processing and a computer version. A software, softwares are available now, voice to text. Implementation of a nursing chart, discharge summaries. Now discharge summaries, no need to sit in front of a system and go on typing. A discharge summary, voice to text recognition commands are already implemented in the many of the hospitals. Integrated tool for the discharge summaries, OT notes, integrated for a medical dictionary, which will avoid the typographical errors, which are automatically integrated with the SIMS pharma lab, as well as medical dictionaries are integrated with this. And data analysis and a smart reading. Search engine uses a click of a button can generate you enormous ICD diagnosis and OT procedure data. So if you are looking for, I mean, how many patients have undergone, health checkup, diabetes. If you just put the parameter, automatically it is going to show me the data. Okay. Data will be a teaching tool for the postgraduate student. What we enter, what treatment plan we have entered for the patient, this data will become a teaching tool for the upcoming postgraduate. What is the future of AI in healthcare? The greatest challenge to AI healthcare is not whether the technology will be capable to useful, but rather ensuring the adoption in daily clinical practice. We can get a technology, but we should make a practice of using it in our day-to-day activities. In time, clinicians may migrate towards the task required by the human skill. The highest level of cognitive function, perhaps the only healthcare provider who will out the potential of artificial intelligence healthcare, may be those who refuse to work alongside. What is the impact on nursing care? AI is more accurate, predictable fall risk without a manual calculation, a PMI kind of a thing automatically calculated, and it will give you the many warnings in the system, automated notifications, like what I said, notifications like admission as soon as happens, automatically notification will come. As soon as discharge, to prepare the discharge summary, automatically one notification is sent to the housekeeping to clean the bed. As soon as a nursing staff will click a discharge, a notification will be sent to the housekeeping department to prepare a bed for the next patient. And robot, of course, we cannot ignore the major part of artificial intelligence. Robots, how robots are going to help? As Madam said in her initial introduction, like drawing the blood samples, calculation of the BMI, and for example, now if you consider the what is that continuous glucose monitoring system. Nowadays, smart strips are coming where you can stick the strips to the patient's shoulder. It will take n number of samples from the patient without knowing, and those samples, whenever the diabetes levels decreases to the abnormal values, automatically it is going to alert the nursing counters, and patient rooms equipped with Alexa sound system, like SOS kind of a thing, where the senior citizen patients are admitted. If any nursing care required, if they just type a SOS or shout a SOS, Alexa will send you the alert to the nursing counters. Need a urgent report and urgent attention to the patient. These all are quite possible. Only challenges are cost effectiveness of the adoption of the system. Initially, these systems are coming very expensive. Nowadays, also it is very expensive. In further days, the technology will become a takeover to the complete clinical practice. Thank you. I hope understood the session. If any questions are there, can be.
Thank you, sir. Thank you so much for giving us your valuable time and sharing us mainly the new concept, which is the AI is going on. AI is like a very vague topic, but the thing is, when we go into the main concept, which you as a resource person are elaborating it, it is making us understand. And in future also, maybe everything will be technologically based and less paperwork. So you have already told about the how the data will be processed, and actually it is like making the paper less work also, and also the record system will be improvised. Thank you so much, sir. You also have elaborated like how there's implementation in e-administration, like duty rosters and including leave. Well, anyway, the online circulars are very easy, sir, because what is coming up next is it immediately will be in on a WhatsApp or on a screen. We can just monitor it, including the patient's data. Once we have not to wait for the records or the reports from the labs and all. Immediately it is displayed, and then we can work out faster. Then we get the report. Sir, thank you so much for giving us this, giving us your valuable time and sharing us your most the valuable topics, sir. So thank you, sir. Thank you so much. Sir.
Thank you, madam. Thank you for providing an opportunity to speak about
Welcome,
AI.
sir. Welcome, sir.
Thank you, Ravi. Thank you so much, Ravi, sir. Actually, I just wanted to add here that we were partnering. We have started to partner with engineering colleges. Like if you are deemed to be university, you can always partner with your engineering college faculty for developing patents and newer technologies which can be used in nursing based on AI. And there's one add-on to it is if you're a female in the team of male engineers, then your patenting, your granting, your funding, your commercialization is faster and you get them sooner. I learned this with my experience because we had developed a IoT based COVID face shield mask to identify pulmonary dysfunctions and disorders in COVID patients. I just told the colleague that this is what we are looking for. Everyone in this first and second wave were hesitant to touch the patients. And only on the idea, he developed such a wonderful IoT based face shield, which is gone for patenting and commercialization now. And because my name was there in that as a female, so the process got hastened. Then I also told him once ki I want to have an ampule cutter ray, because in the house whenever I give injection to my in-laws, B12 and other things, I take a spoon or a knife and I try to break the ampule. Of course we do have ampule cutters in the ICUs, but I said कि ऐसे कुछ होना चाहिए which can be commercialized कि medical shop में भी ampules के साथ वो रहे. And that fellow is from I think NIIT Surathkal. He developed a device of ampule cutting where if you insert the ampule in the device, it will show red, orange and green light. I said ये क्या है? He said madam red light मतलब expiry date हो गया, orange मतलब होने वाला है और green मतलब ठीक है. मैंने कहा ये क्या मैम, और भी कोई फीचर्स है तो आप बोलिए, क्योंकि बहुत कम फीचर्स हैं इसीलिए ये पेटेंट नहीं हो रहा. So you know, this is how we are the nurses who work in the ground level, and jab tak we nurses will not tell the engineer or the IT guy or the person that what we want to make our job easier, I don't think they will anytime be able to step into our shoes and help us with what we really need to do. That's what I just wanted to add up here. Thank you so much.
Yes, madam. There is one more thing is there. One engineer scholar have designed synthetic hands for a patient who don't have hands. That will work. Such a technology is implemented. It will communicate with the brain, and that hand will automatically hold a glass and get up. All his basic necessities he can perform without anyone's help. There is huge contribution.
Yes, and even every department, you work with the CS department in an engineering college as a nursing college, your UG projects. If you have your research project in third year, you take some of your third year UGs and engineering UGs and make a small group project, because youngsters have a lot of ideas than us. We are getting old. And then their CS has some ideas, their mechanical has some ideas. We had done that patient shifting slider, you know, for a pediatric group to shift them into the bed. Another thing which I really wanted to tell here was we teach the students episiotomies or giving IM injections in the lab. We have only 1 or 2 costly dummies which we are so hesitant for the students to touch. Then I asked the mechanical engineering department, can you make some nice thing, fluffy thing जिसमें हमारे students 100 students 100 बार वो IM injection सीख सके, you know. And even the episiotomy suturing के लिए, if we have that kind of material where it is easy to suture, so we are working on it. So there are great ideas if we think and work. We always work, हम nurses हैं, हम बस अपना ही. But if we work as an interdisciplinary team, people respect us because they get so much of inputs from us. They have everything, but they don't know what to do until unless we give them the inputs about it. Thank you, Ravi, so much.
Thank you.
So one question, this from the delegates, all are appreciating the session. Thank you so much, sir, for that. And already they have understood that how much nurses can save the time and utilize for the other purposes. So there's one question like the one of Dr. Vanaja has asked, is there any software or apps that are commonly used, that which can be commonly used or less, because all the time we have to go in the Google Play Store and we might have to store it, and everybody should have it. So whether common app is there, whether it can be utilized in nursing, including the education academic purpose.
Microsoft is exclusively introducing a nursing technology, adoption of technology in the nursing practice. Microsoft is coming up with a, Microsoft is a huge technological innovations. Every day they are rapidly changing their technology. Considering the healthcare parameter, they are introducing a topic called adoption of technology in nursing practice.
Can I add, Nirmala? Like Government of India, Ministry of Health and Family Welfare, INC, they have the Safe Delivery app, which has come up for the fourth year students now to use. Yeah, and it is a part of the Indian Nursing Council curriculum also. And same way, like there are a lot of LMS platforms, learning management system platforms, which can be purchased, like MOOC platform, or which are free of cost. Like one here is of Astrika. Yeah, Astrika Sphere is there. Janvi Nilikani works with us on Astrika Sphere platform, where we can make modular learning modules and put them there, so that our students do not have to sit 9 to 5 and do it. In their spare time, they can take it, then generate the pre-test, post-test, e-certificates, everything. Like how we undergo NPTEL course for fundamental of basic research and other things. This has to come into nursing. We have to offer a lot of value-based course modules through this kind of platform, so that it is easily available for the nursing students. And another app place thing for ANMs and grassroots level workers, there's a lot of research going on, like having a app which can identify the danger signs of PIH, Jada BP, Kam BP, moderate BP, with different flags. That can be done. And a lot of M-learning platforms are coming up, where you have M-learning apps for students. One which we worked on with University of Southern Cross University, Australia, we worked on developing a learning app. And it was not me or they. We are nurses. We don't know the technology. So we worked with an app company called Practera, which took away all the funding of ours. Around 29,000 Australian dollars we got. Everything went to Practera because they developed the app for us. So there's so much of scope for these app companies also to come into healthcare delivery system now, because we have so many needs like this. So now I'm little bit finding it interesting to talk. पहले मुझे लगा I don't know anything about AI, but now you can correlate. I think all of us who are attending can correlate with so many things which we face every day. Thank you.
Now, COVID also has helped, ma'am. The apps only have helped us in communicating and the academic process to be going on. So some or the other where AI is helping, but we are somewhere unaware of this. That's all. Thank you, ma'am. Thank you, sir. Thank you, ma'am.
Thank you, madam.
So now we'll move on to the next session. Sijila, ma'am.
Yes. Am
Yes,
I
ma'am.
audible?
Yeah. Yes, ma'am. You're audible. I will just introduce you, ma'am, and then we can. Yes. Good afternoon, ma'am. Good afternoon, ma'am.
Good afternoon.
Yeah, ma'am. Here we have the next resource person, Dr. Sijila CH, Professor cum Vice Principal, MIMS College of Nursing, Malappuram, Kerala. Ma'am has completed a BSc Nursing in Mahatma Gandhi University, Kottayam, Kerala in 2000. In 2006, she has completed a MSc Nursing in Medical Surgical Nursing for Specialty in RGHS, Bangalore. Ma'am also completed a PhD in 2018 in Manipal College of Nursing, Manipal. Ma'am has a teaching experience of 15 years and plus from the basic till now, where she is working. Ma'am has additional qualifications, like she has a certificate in biostatic research methodology and epidemiology from 2014. Also, she has a certificate in Bioethics Center of Bioethics, Manipal Academy of Higher Education in 2016. Ma'am is also a certificate program in KUHS Quality Assurance System, Kerala from 2021. Certificate program in Health Science Educational Technology in Kerala University of Health Science 2021. Ma'am is currently pursuing a FAMER fellowship in Mahai FAMER Institute. Ma'am's research work is remarkable. Department of Health Science is working with, like she has so many grants, and with the Government of India grant in 2018, she was working with the Department of Health Science Research as a primary investigator. She was a co-investigator in the research grant in 2018 in Nursing Research Society of India, and also a primary investigator in 2014, the Sigma Theta Tau International Honor Society of Nursing with Omicron Delta Research Grant. Good, ma'am. Science and Engineering Research Board, Department of Science and Technology. She had a travel grant for attending the ICN conference in 2016 and UICC travel grant for attending World Cancer Congress, Kuala Lumpur, Malaysia, 2018. Ma'am is also having a travel grant again in attending the Leadership in Action meeting in Singapore in 2019, ISNCC conference scholarship for attending the ICCN conference in Feb 2021, and conference organizing grant in 2018, that is Aging a Biological Reality, Let Us Embrace ICMR. Excuse me. Publications, ma'am has 7 Scopus indexed and other indexed 4. Ma'am is papers under review are 2, but ma'am also has presented in National 6 and International 6 and National 4. She is a resource person in International 2 and National 10. Many conferences she has organized, like International 3 and National 2, 8. Other conferences when she has attended is almost 25. Ma'am is also a journal reviewer in Web of Science. There are a list of journals ma'am is where she is a reviewer. Ma'am's awards and fellowships. Ma'am has a fellowship award by Dr. T.M.A. Pai Fellowship for full-time PhD in Nursing Mahé in 2013. Ma'am has award Scholar Research Excellence Award in 2021, Best Teacher Award Nursing 2020, Kerala University of Health Sciences, Kerala, India. She is also awarded as a Best Paper in Manipal College of Nursing in 2018. Ma'am, really it was a great to introduce you, ma'am. Really it was somewhere we have made it short so that to conserve the time. Now we'll be enabling you, and please you can continue with the next topic of the application of AI. Thank you so much.
Welcome, Shijila ma'am.
Very good
And Sudha
afternoon
here.
to all of you. Yes, ma'am. Good afternoon, ma'am. And thank you so much for giving this opportunity to have a session in your nursing webinar. And I will be straightly going to the session, ma'am, because I have to leave to college. Actually, I am on leave, but due to some inspection purpose, I have to go to college. So I will be actually taking the sessions very fast. Sorry. Whether the screen is visible?
Ma'am, with the screen, that green color down, which you can see with the mic camera, and next is screen. You can just go there. Yeah, yes. You can just go. Yes.
Just go to slideshow.
Oh, okay. So I will be dealing the topic application of artificial intelligence in nursing. So we all of us knows that digital technologies are transforming the health sector all over the world, and
Your
the
slides are
exponential
gone.
growth in
Your
My
slides
is
are
gone.
Mm.
Yes. Once more.
Mm.
Now is it visible?
No,
Mhm.
ma'am.
In between we saw it and then it disappeared.
Ma'am, I think it is minimized, just you can.
Yeah.
Is it visible now?
Yeah, ma'am. Only you can go to the slideshow, ma'am. Make it a slideshow.
Yeah, now
Yes.
is it visible now?
Slides are visible.
And the exponential visible
Disappeared again.
again?
No. I think you must have minimized this. Just check. Yeah, now it's visible.
Yeah, yes. I have actually minimized it that so I am not able to see it actually.
You can see it. So when you see, we can't see. When we see, you can't see. Is it like that?
Ma'am, should I share?
Yeah, yes.
Should I
You
share?
can share, no problem.
Yes.
Yes.
You can start schedule.
Yeah, then the exponential growth in digital technology, which is coupled with the global COVID-19 pandemic, is driving profound change in delivery of medical care and research conduct. Digital health technologies use computing platforms, connectivity, software and sensors for healthcare and related users. Then the broad scope of digital health include categories such as mobile health, health information technology, wearable devices, telehealth, telemedicine, and personalized medicine. Is there any problem?
Like we are trying to share your slides. So till then, many of the people in chat box are saying that the slides are not visible and audio is also not hearable. So Nirmala, can you connect it from your DON office?
Yes, ma'am, we are doing it. That's it.
आप ही उनके स्लाइड शेयर कर रहे हो ना?
Yes, ma'am.
हाँ. Yeah, we'll make the PPT visible, Ashwini.
She's
Trying to do. नहीं, अश्विनी चैट बॉक्स में थी इसलिए मैंने उसको आंसर किया. Shiji, it's great to have you here with us. Let's just get over this technical hassle and you can go on. And very impressive that
hear
you.
me, ma'am?
We can hear
I'm
you,
able
yeah,
to
but we can't.
Yes,
Yeah.
but certain I saw somebody in chat was telling it is not audible.
Yeah, someone told me also that it is not audible, but we can all hear you. There must be a problem with that person's. Yeah, now the scene
Okay,
has.
thank you.
Yes. Mute.
Second slide. Next one. So we have discussed about how this healthcare technologies use computing platform, connectivity, software and sensors for healthcare and related uses, and digital health, which include categories such as mobile health, then health information technology, wearable devices, telehealth, telemedicine, and personalized medicine. So when I will be talking about artificial intelligence in nursing, we should know that there are the terms digital health technology, robotics, and artificial intelligence are terms that are coinciding. So next slide, please. So about the history of artificial intelligence, it is an expansive branch of computer science which focus on building smart machines or intelligent machines. And the term artificial intelligence was coined by John McCarthy, and who is known as the father of artificial intelligence in the year 1955. And he is basically a mathematician and a computer scientist. And he was working when he was working in Stanford University, he has founded Stanford Artificial Intelligence Lab, and which is one of the leading centers of research in this field. And artificial intelligence rely heavily on natural language processing, machine learning, deep learning for its functioning. Next one. So what is meant by artificial intelligence in healthcare? Artificial intelligence in healthcare is an overarching term which is used to describe the use of machine learning algorithms. Algorithms are the building blocks for artificial intelligence, and use of softwares or artificial intelligence to mimic the human cognition in analysis, presentation, and comprehension of medical and healthcare data. So we should know that this is use of certain machine learning algorithms, software, which is used for analysis, presentation, comprehension of complex medical and healthcare data. Then what is the difference between AI and traditional technology is that in AI, it is having an ability to gather data, process it, and give a well-defined output to the end user. So a lot of data will be gathered and it will be processed, and finally a well-defined output will be given to the user. That is the difference between the traditional technology and AI. Then why do nurses need to know about AI? One is for monitoring the population health, then pinpointing the best patient outcomes, and administer treatments optimized for each patient. That is, we can provide patient-centered care. Then finding evidence that are pertains to the individual patient, so that we can use evidence-based practice for the care of patient. Next slide. Again, before that, previous slide. There is in application there are 8 areas where the artificial intelligence in nursing and healthcare is used. The first one is keeping people healthy, then in the diagnosis of disease, then early detection of disease, in treatment of the disease, then in clinical decision making, in end of life care, then in research, and in training and education of health professionals. So that are the different areas. There was an image that is not visible now in the next slide. So there are 8 areas where AI can be used in nursing and healthcare. Next slide, please. So how to keep people healthy? So technological applications and apps will encourage healthier behavior in individuals and help with the proactive management of healthy lifestyle. So many of us may be using smartphones, smart watches, and other bracelet devices and all for checking our heartbeat, mostly our exercise, heartbeat, heart rate, rhythm, then even saturation level, then BMI and intake of calories and all. So these are type of AI, artificial use of artificial intelligence to keep people healthier and maintain a healthy lifestyle. So nurses have a major role in prevention of diseases and educating the patient. So this will help the consumers. Actually, this use of these smart technologies will help the consumers to keep them healthy, and it will be helpful in prevention of diseases, early detection and prevention of diseases. Next slide, please. So the next use is in early detection of disease. That is, already it is used to detect diseases like cancer, especially in early stages. We can detect breast cancer even more with the 30 times faster, with 99% of accuracy, and it can reduce the need for biopsies. Even lung cancers can be detected in an early stage. Then consumer wearables and other medical devices will be also used to detect, especially heart diseases, enabling the caregivers to monitor and detect life-threatening episodes more earlier and in a more treatable stages. So many of the heart disease and even stroke can be detected by using this AI in an earlier stage itself. Next slide. Next slide, please. Can you just change the slide? So this is how to detect the use of algorithms for natural language processing for detection of cancers through endoscopy, CT imaging, and all. Even ECG monitoring can be used to do variation in ECG can be used to detect these heart diseases in an early stage. Next slide. Then the third use is it can be used for the diagnosis of disease. So there will be fast and precise diagnosis, increased diagnostic accuracy, which can reduce the cost, and there will be more staff satisfaction, then improve patient outcomes, so that because of the accurate diagnosis, more personalized therapies can be planned. Then reduction in the amount of unnecessary intervention and surgeries, and because of precise diagnosis, unnecessary surgeries and other interventions can be minimized. Then enhancing quality of service as the patient receives the diagnosis faster. So the quality of service provided to the patient will be enhanced through these diagnostic methods. Next one. Next slide. Next is, it can be used for the detection of skin cancer for lesions, identifying prostate cancer, detect liver lesions, cervical cancer screening, and eye disease detection through optimal coherence tomography. These are some of the these are the areas where this AI can be used to detect different diseases. Next slide. Then next is use of artificial intelligence in clinical decision making. So it can support the clinical decision making and actions that will prioritize the administrative task, using pattern recognition to identify patients at risk of the disease condition. It may deteriorate due to lifestyle, environmental, genomic, or other factors can be detected early. Then valuable time and money can be saved, and taking strain off from the healthcare professionals and increasing comfort of the patients. Already Mr. Ravi Shankar has explained that how this can be used in clinical making or decision making. So clinical decision making support systems can be used for making clinical decisions about the patient. Then next slide. Then in abroad countries, these nursing decisions are made. There is a tool which is made by using artificial intelligence, like Rothman Index. It is a tool which reflects the patient acuity and risk to identify the patients at risk. This Rothman Index was used by Yale New Haven Hospital Nursing Service. It is usually using some electronic medical record data along with 26 variables, including 11 nursing assessments of which will be displayed in the form of a graph to identify the patients at risk. So other areas like determining the bedsore score. So the images from the wound or the bedsore or any lesions can be used to identify the patient's bedsore scores. Then calculating patient's vulnerability status, early identification of sepsis, then in pain assessment and in assessment and triaging of patients for categorizing and prioritizing the patients, AI can be used in clinical area. Next slide. Then it is also used in clinical data assessment and care planning. Also, artificial intelligence help to plot the data, which help to view the health parameters and progression of the patient. So already Mr. Ravi Shankar has already explained to us that many of the things what is being recorded, so what input we are giving, like patient assessment and all, what input we are giving to that system, so that will be usually finally used for seeing the progression of the patient from the beginning of the admission till the recovery stage. We can use and compile the assessment data, and which is used for each day's care planning for each kind of patient. So that this is very important, because we have to give a personalized care for each patient based on the clinical data assessment. Next slide. Then in treatment, how it can be used, AI can be used in treatment. It is also used for comprehensive approach in disease management, better to coordinate care plans and help the patient to better manage and comply with their long-term treatment programs. And this is especially used for the treatment of diseases. AI can be used for treatment of some genetic disorders like muscular dystrophy, then targeted treatment in cancer therapy. Then Burge is an AI-based biotech platform which is used for creation of advanced breakthrough in medicine development and vaccine development. So it is also used for the treatment of Parkinson's disease. Many of the diseases like dementia, Parkinson's disease and all can be treated by using this artificial intelligence technology. Next slide, please. Then it is also used in medicine and surgery. In addition to surgery, it is used in hospitals for in lab for repetitive tasks, in rehabilitation and physical therapy, and in support of patients with the long-term conditions. Those who are require any rehabilitation or any physical therapy, artificial intelligence and robotics can be used. Next slide. Then in pain management, this is an emerging area of artificial intelligence loop. By leveraging virtual reality combined with artificial intelligence, and simulated realities can be created so that patient can be distracted from the pain, and even it will help in opioid crisis and all, and the opioid usages can be minimized by using this artificial intelligence in pain management. Next slide. Then there is another area where nursing assistants, virtual nursing assistants are used. So the first virtual nursing assistant, which is used for the care of patients, was used in 2015, and the name of that virtual nursing assistant is Care Angel. This was developed in 2015, and this virtual nurse assistant can perform a range of tasks from conversing with the patient and directing them to best and effective care unit. And many of us know, when we are entering into a hospital management system, we can see that there are chatbots used. So these chatbots are all using artificial intelligence technology. So may I help you like that when we are entering into the hospital system or maybe to the nursing system and all, no, there are chatbots is used. This is also an example of a virtual nursing assistant, use of AI in nursing care. That it enable more regular interaction between patients, care providers, between office visits to avoid unnecessary hospital visits. Many of the times, any patients with chronic conditions, they can chat with the virtual nursing assistants, and they can minimize the hospital visits, because these virtual assistants can provide solution to the patient's problem. So especially elderly, it will be difficult for multiple hospital visits. So many patients can save the hospital visits, cost of treatment and all, by using the virtual nursing assistants. Then another virtual nursing platform is TAVI, where nurses can use and educate patients about how to manage the medical conditions and live a healthy life. Then patients can answer multiple choice questions, which TAVI will put into its algorithm and select and give a collection of educational videos. So TAVI is an educational platform, healthcare education platform, which can be used artificial intelligence, that is using artificial intelligence in nursing. Then next slide. Then robotic in nursing. Robots can perform nursing functions such as ambulation support, then vital sign measurement, then medication administration, infectious disease care, exercise and rehabilitation care, and it also help in many of the non-nursing tasks which is performed by nurses can be done with the help of robots, so that nurses can spare their time for actual patient caring. So this is one advantage of robotic in nursing. Next slide. These are some examples where robots are used, especially during the COVID pandemic and all. Many of the countries like China, Thailand, and Japan has used robotic nurses to care patients. So these robots can be used for giving injection, then lifting up of patients, then it can be even used for medicine indenting and medicine delivery, and then direct patient care, giving exercise. This picture shows giving a robot giving exercise program for patients, physiotherapy or exercise program for patients. So these are some of the uses of robots in nursing. Next slide. Then usually AI is used in telehealth and telemedicine. It covers services like health education. So many of the people, those who are in rural areas or remote areas, can be covered by using AI in by incorporating AI in telehealth and telemedicine. Like they can be remote patient monitoring. Most of the time, the patients will be connected with some sort of devices or some bracelet or devices that can be connected to the computer, so that remote patient monitoring, like saturation monitoring, monitoring of heart rate and rhythm, the exercise tolerance capacity of the patient. So these things can be done through the help of AI. Then patient consultation via video conferencing. This is also can be possible by means of AI. Then wireless health applications. Then transmission of imaging and medical reports. Many of the time, the patient images which is taken from the rural area, that can be transferred. Even mobile phones or mobile technology can be used for transferring the images and medical reports to the main hospital, where there are satellite hospitals. So many of the corporate hospitals will be having remote satellite hospitals and satellite sub-centers or primary health centers, and also like that, by using AI, telehealth and telemedicine can improve the healthcare to the patients or people those who are in the remote areas. Next slide. And then AI in administration, in nursing administration, already Sir has explained about e-administration. So AI plays a high performance role in staff management, then requirement assessment during the clinical areas. It develops recruitment assessing tools and predictors for trainable staffs in administrative roles. He has already explained that this staff training, even for preparing the duty rosters and online conduct of programs, and even the leave management and discharge, preparing the these rosters, leave management, in everywhere in e-administration also artificial intelligence can be used. Next slide. Then use of artificial intelligence in end of life care. So robotics are potential to revolutionize the end of life care, helping the people to remain independent for longer and reducing the need for hospitalization and care homes. As we know that the aging population in the world is increasing. Many a times the aged population, there are the retirement homes and even people those who are in old age homes and all. So these people, this artificial intelligent technology can be used, like smart home. There is a term known as smart home development that is using AI, like that. Different robotic and other sensors and devices can be attached to the patient, so that the patient's health can be monitored in the particular hospital or where they are seeking treatment and all. And even in case of this care of many are isolated in homes. Many of the older people are isolated in homes. We can use certain robots, like one robot is Paro. Paro is a social robot which can enable the older person to have social interaction and conversation. So one is like that, Paro. Then another one robot name is Pepper. Pepper is another robot which is designed by different AI companies. So they have used this for monitoring the oxygen saturation, BP, body weight, heart rate, and as well as these exercise levels and all in elderly persons. So there are, as I told, no, the TAVI is another educational AI system which is used for always teaching, even in HIV care, HIV education, which is used for HIV education and all. Then DINSO is another type of robot which is designed to assist with the mood improving activity and reminders for taking medication. Most of the elderly people are having them, they are suffering from memory loss, dementia and all. So these type of robots can be used to remind them of taking medications in an appropriate time. So these are some of the uses of robots in end of life care. They are capable of serving, fetching, communicating, and offering even emotional support for the, and even there are pet robots. So certain old people, they like to have pets at home, or maybe so even pets, even for the care of children also some pet robots are used. So these are certain examples of AI in use in end of life care. Then next slide. Then AI in research, mostly artificial intelligence is used in drug research, discovery, redesigning the drugs and vaccine development and all. So apart from that, even nursing research should focus on contribution of nursing to AI technology development and implementation. From 2014 onwards, there are a lot of robotic project grants. The grants are being funded by National Science Foundation in US to promote the use of robots in nursing activities. So there is funding from different agencies for the development of robots for nursing activities. Next slide. Then clinical trials also. These AI can be used in clinical trial at participation of patients in clinical trials, because most of the clinical trials will be using large amount of data. So it may be a recruitment of large amount of people, or maybe recruitment of people from multiple centers and all. So it will be difficult to handle by human manipulation, and also we can use artificial intelligence even in recruitment and identifying the characteristics of patients, or patient for recruitment and all. This AI will be used. So it will help to find out the right candidates for development of drugs, or using interventions for various diseases and disorders. So that is the use of AI in clinical trial and clinical trial participation. Next one. Next slide. Then other researchers in nursing robotics. So telehealth community health assistance team, or TCHAT team, it is a nurse-led telehealth robotic project to evaluate nurse-led intervention for promotion of healthy lifestyle and chronic illness management using a telepresence robot. This has been used in certain retirement homes. So this project was being taken by Duke University School of Nursing and Duke University Engineering College. So there was it was a combined project which is used to, for evaluating some nurse-led interventions for promotion of healthy lifestyles in older people. Then another project is Telerobotic Intelligence Nursing Assistant. This is developed by Cincinnati School of Nursing and College of Allied Health Science and Engineering. So this was used to address the health workers who are at risk for infection due to routine interaction with patients, handling of contaminated materials, and challenges associated with safely removing the protective devices or gears. So this is used for, especially for care of nursing person itself. Then next slide. Then again, artificial intelligence can be used for training and education. So AI opens its world of simulation based learning and various skill training, and it can be done at anywhere with the power of AI, which is embedded even in a smartphone. Even it can be used after some clinical sessions, or maybe traveling and all. We can use this smartphone device for learning this simulation techniques and all. It empowers the nursing students and even blooming nurses to practice the procedures safely and master it before they are going to apply it on the real patient. Next one. Next slide. Next slide. Then it is use of humanoid robots and cyborgs can complement the existing high fidelity simulators. We know that SimMan is an example of a high fidelity simulator. So different AI devices or humanoid robots and cyborgs can be used to complement to the high fidelity simulators and technologies. And there are face trackers that are available to trace the emotion of students when they are performing the simulation as a part of evaluation and improvisation. So certain face trackers can be also used to evaluate the performance of students during some clinical procedures. Then different handbands for students are available to evaluate and monitor the performance, especially though while they are performing hand washing procedures. These handbands can be used to detect any how they are performing, whether they are performing it perfectly or not. Then educators can use different teaching tools to simulate interactive clinical sessions, and this technology will improve the communication skill as well as team management of students, which will boost the confidence of the students. So we can use different technologies. Then various virtual realities and simulation bases will be embedded in clinical based education. Then monitor and guide the progress. AI also can be used for the monitoring and guiding and the progression of a student based on the some database softwares which will be providing individualized assessment evaluations during and at. So for summative as well as for the formative assessment, these AI based technologies can be used to monitor the performance of students. Then certain virtual avatar apps and patient gaming apps, virtual tutor chatbots, these are also can be used in nursing education, and certain nursing tools to stimulate interactive clinical scenarios and increase the students' comprehension of certain nursing subjects. Most of the time we may be without our knowledge, we are using, especially for those who are writing thesis, doing research, and we are using some softwares for Grammarly and spell check. So this is also a use of artificial intelligence, like Grammarly checking, checking the our plagiarism check and all is also a kind of use of artificial intelligence in education. Next slide, please. Then apart from education, it can be also used in primary healthcare and triaging. Mostly this will help you even when AI chatbot services and all, if it is used, that will save the patients, avoid the trips and save money and time for the patients. Next one. Then again, in hospital setting, it will minimize the burden of electronic health record usage. Many voice recognition devices. An example, simple example of a voice recognition is Google Assistant. We are using Google Assistant, Alexa, and Siri in Apple phone. These are some voice recognizing systems which use artificial intelligence technology. So this will enhance clinical documentation process and processing the routine requests from the inbox, such as medication refill and notifications and all, can be done through this artificial intelligence. Then next slide. Next slide, please. Then this is also, as Sar has already explained about the use of medicine indenting and also these artificial intelligence can provide or indent medicine with a more accuracy, so that medication or dosage errors can be minimized in our daily nursing routine procedures. Next one. Then it is also helps in reducing the healthcare tasks, so that this most of the time AI and computer system will be, softwares will be handling many of the administrators work. They can save and spare their time and working with certain important tasks. See, it's like that Olive is an AI based platform which is used for medical claims, transferring the medical data and all. Next one. Then improving the healthcare access. So we have used medical software with interactive and customized health services like anytime appointment, making repetitive appointment with patients, planning for the any laboratory test and all. We can use these chatbot services and all in different hospitals. Then next one. Then benefits of artificial intelligence, that is delivering better and faster services, reducing unnecessary workload, then ensuring healthcare accessibility to every section of the society by using telemedicine and telehealth services. It is almost available for even to the people in remote and rural areas. Then identify at early risk of disease and potential to assess the outbreak of disease. That is also another benefit of AI. Next slide. Then AI, which is used in pandemic situations, which can be used for communication. The simple example is Arogya Setu app. What we have used and still using is an example of AI in pandemic situation. For contact tracing, preliminary screening and diagnosis, AI is used for as administrative assistance, like receptionist, robotics and AI can be used for receptionist, and bed allocation in hospitals, triaging and all, AI can be used. Then for vaccine development also, artificial intelligence can be used. And one example is our development of COVID-19 vaccine. This is an example of a vaccine development. Next one. Next slide. Then like other technology also, it has also got pros and cons. So the pros include improved diagnosis, serve rural community, better clinical decision, and it streamlines several processes. So by analyzing the data and giving it within seconds, it can streamline several processes. Then the cons include complications in learning AI, then difficult change to adapt. Many of the people are not adapting latest technology, so difficulty in changing to accept the technology requires certain human assistance. Whatever maybe it is an artificial intelligence also, human intelligence is also needed to develop this technology. Then require implementation of a correct AI platform. That is also another disadvantage or a cons of AI. Next one. Then challenges include in implementation include privacy and security of the data, because almost all the data is in the software. This may breach the privacy of the patient. Then inaccurate or missing data. Certain times this fragmented healthcare system and all will lead to missing or inaccurate data. Then implementation of artificial intelligence in emergency settings. Even though AI can be used or robots can able to do CPR procedures and all, and in certain times in emergency setting AI cannot be used. Then other issues like data protection issues, quality of services, hazards in the clinical safety, then clinician and patient relation, even nurse patient relationship can be affected by implementation of this AI. Then next slide. Then threat of artificial intelligence. Next one. So one is errors and injuries. Sometimes the AI system can become wrong, and usually when if we are doing a wrong procedure for a patient, that only one patient will affect, but this AI system can lead to injuries to thousands of patients, because this is being used by many by means of software or smart devices, and also these errors and injuries can endanger thousands of lives. So that is one disadvantage or threat. Then data availability. So usually the data is integrated from different sources like pharmacy records, medical records, electronic health records, insurance records and all. So sometimes the data can be fragmented, and there may be people, those who are switching from one health center to another health center and all. So sometimes it may become complicated, and it may give some errors, and it increases the cost of treatment also. So data availability can be a problem with artificial intelligence. Next slide. Then privacy concerns. Already I told you that it can because this is all software based system, so it can violate the patient's privacy, and many without the patient's knowledge also many people can access the private information of patients. That is also another problem with artificial intelligence. Then next one. Next slide, please. Then bias in inequality. So there may be sometimes if whatever data we are incorporating or entering, so sometimes that can lead to from different medical centers or different treatment centers, that can lead to different bias and inequality in the treatment. Next one. Then it can lead to shift in profession. Finally, deployment, or especially in the field of many medical profession, because of artificial intelligence, human power is not needed anymore. So this is also a threat in future. So many nursing jobs, people will be losing their jobs because of artificial technology and intelligence technology and robotics and all. So many people in the healthcare profession, even people those who are in radiology, nurses and lab, those who are working in physiotherapy department and all, they may lose job in future. Then next one. Then AI in future, it can be usually more widely used in healthcare professional education. It can be used in diagnosis of diseases. Then current structure of insurance, health insurance also will be replaced by artificial intelligence powered subscription services. Then robotic replacement in certain jobs. It may be can be widely used in the care of aging population, drugs and vaccine development, and finally, because everything is in the internet and computer and also hospitals themselves may not exist in future because of this AI technology. That is also maybe the care can be sought through virtual assistants and all. Then recommendations to integrate AI in clinical practice, education, administration, and research. So first of all, those who are working in the clinical area, how to equip the nurses with requisite knowledge and skills to use these tools, as they may work their work environment through professional development opportunities. So conferences, workshops, and people should be encouraged to undergo different courses in AI and all. So that is the best thing to equip them with knowledge and skill. Then assume responsibility. Each one, we should be technologically adaptive person. So we should assume the responsibility for upgrading the skill in artificial intelligence, and we have to take apart from each person has to take initiative to study these technological things. Then curricular reforms that can be included in all education levels, starting from baccalaureate program to the doctoral program also. There are maybe incorporating certain subjects like basic informatics competencies, data analytics, then predictive modeling, ML principles, engineering principles, digital data literacy, ethics, privacy issues, these all things, even health informatics and nursing informatics, big data governance, this technology centric cultural competence, all these can be included in the nursing curriculum in the future. And educators, practicing nurses and students they should remain actively engaged in planning and implementation of this technology, thereby enhancing opportunities for the successful integration of AI in practice, education, administration, and research. So we should actively participate, whatever, maybe students or maybe nurse educators or practicing nurses should actively participate in development and implementation of the artificial intelligence. Next slide. Then to conclude, despite some setbacks and limitations, artificial intelligence in nursing and healthcare are virtually announced every day. It is growing day by day. So artificial intelligence and healthcare technology are transforming the health systems as they are currently exist, and nursing profession need to be actively involved in this rapidly enabling or evolving process. In collaboration with other healthcare disciplines, nurses are in ideal position to lead researchers on artificial intelligence and healthcare technology, especially multidisciplinary approach, that is integrating different people like software engineers, then people from the medical background, then people from different aspects can be used to develop and implement this technology. Even robotic engineers can be used in collaboration. So multidisciplinary approach is needed for a development and implementation of AI in healthcare. And to conclude, I would like to state the word of Fernandez. He has stated that the transformation of curricula and professional practice focusing on interpersonal and intrapersonal intelligence with attitude that value human skills will ensure nursing practice or role in a society which is dominated by machines and scientific process. Whatever technology we are using, we should maintain that high-tech, high-touch approach. So the basic core of nursing is providing compassionate care for the patient. So even though we are using this artificial technology, we should not leave that. So we have to use, even if we are using the high-tech technology, we should maintain and give compassionate care for the patients. That's all. Any doubts? Any doubts? I had to run a little bit fast.
Yes,
Any
ma'am.
other
Sorry.
doubts?
Yeah.
No.
Anybody is
Regina,
having
excellent presentation, Sajila, and you can go. Anything is there, we'll let you know through chat box. And
Oh, yes, ma'am. Actually, ma'am, I have to leave to college. Okay,
Please,
I'm
please,
leaving, ma'am.
please. Amazing
Thank you so much.
presentation. Congratulations.
Thank you, ma'am. Thank you, ma'am. Thank you.
Thank you so much, ma'am. Thank you.
Nirmala, you can continue.
Yes. Okay, good afternoon to everyone. It was an excellent presentation from Dr. Sijila ma'am. Now we are coming to the end of the session from the last session. The resource person is Dr. Ramesh C. He's not a very new person, but each and every webinar we see one or the other session from Ramesh sir. And earlier we had a research meta-analysis webinar with sir also, and it was very awesome. And today also he has given us a valuable time into his busy schedule. Thank you, sir. So I take a privilege to introduce Dr. Ramesh Chandra Babu. He's assistant professor in Sri Ramchandra Faculty of Nursing in Sri Ramchandra University Education Research, Porur, Chennai. Sir has completed his Bachelor's of Science in Nursing in 2005 and Master's in Nursing in 2008 from the same institute where he's teaching now, the Sri Ramchandra College of Nursing. Sir is specialized in cardiothoracic nursing and he is a recipient of Dr. Jayalakshmi Jambunathan Gold Medal for the best outgoing student in MSc in Medical Surgical Nursing from the same university. Sir has received Dr. TMA Pai scholarship in the year 2013 from Manipal University for pursuing full-time PhD in the Faculty of Nursing and completed his PhD in 2017. Sir is a recipient of Distinguished Alumni Award from Sri Ramchandra Institute of Higher Education and Research in 2018. Sir has received uh, sorry. Yes, sir has received a gold medal for outstanding research publication from Manipal Academy of Higher Education in the year of 2020. Till date, sir has published 42 research articles in various national and international journals. Sir has been a resource person for various workshops on research methodology several times. Sir is a recognized PhD research supervisor at Manipal Academy of Higher Education, Manipal, and Sri Ramchandra Institute of Higher Education Research in Chennai. Sir is a peer reviewer of various reputed national international journals like Journal of Clinical Nursing, Journal of Advanced Nursing, Complementary Therapies and Clinical Practice. Sir keeps on updating on the status and on the Facebook about his whatever the updates are there and achievements. Congratulations, sir. Sir is also the expert member of Publication Guidelines and Monitoring Committee of Rishi Ramchandra Institute of Higher Education and Research. Sir.
Good afternoon, ma'am,
Good
and
afternoon.
good afternoon, everyone. Am I audible? And am I audible?
Yes, Ramesh, you're audible.
Yes,
Good
ma'am.
afternoon, Ramesh.
Thank you, ma'am. Good afternoon. Thank
So
you very
glad
much.
to have you here.
It's my pleasure, ma'am. Thank you very much for motivating me all the time. And it's my always I feel happy to be associated with the Kelly Institute of Higher Education Research and especially Institute of Nursing Sciences. May I share the screen? Please let me know whether my screen is visible. And once if it is okay, then I'll start with my session.
Yes, sir.
Hope my screen is visible.
Yes, sir. Screen is visible.
And the PowerPoint.
Slideshow you have to make, sir. We can see the slides also. Yes,
Is it in slideshow mode now?
yes, sir. Yes, sir. It's in the slideshow.
Okay.
Continue, sir.
I just wanted to hide this tool on the control panel. How to do it? Because it is obstructing my presentation slides.
Nirmala asked Harish to push it up. Yeah, yes.
Yes, sir. क्या करना है?
The right
Yes,
side
sir, done.
panel, yeah. That's okay. I'll move. I'll move forward. No issues.
Yes, sir.
First of all, I would like to bring greetings from Sri Ramchandra Institute of Higher Education Research to all of you. Warm greetings from Faculty of Nursing. Like the topic which is given to me is future of artificial intelligent nursing. Already the speakers have given enough explanation of all the details. My voice is audible?
Sir, your voice is audible.
Yeah, because there are some
and
comments.
also-
There are some comments in the chat box that
No,
the
sir,
voice is.
it was for the earlier, sir. Earlier session. it was.
Yes, sir. We can hear,
Okay,
sir.
fine. Yeah, okay, fine. Thank you. There may be some content, here and there overlapping. Whatever I would like to tell, bring one information is that whatever I speak is all from the available literature. I do not have any direct experience working or handling on artificial intelligent nursing. So I have divided my presentation on all these areas, like where we'll see basics of artificial intelligence and also how it is connected to nursing and nursing practice, and how artificial intelligence are used in clinical practice these days, and what are all the benefits or the uses of having artificial intelligence in nursing, and what are some of the evidences and examples are available, and what would be the future of or the future implications of artificial intelligence nursing. So the artificial intelligence is an umbrella term used to describe techniques developed to teach computers. They mimic like human like cognitive functions like learning, reasoning, communicating, and decision making. The term artificial intelligence itself, we can understand that they are going to mimic the human potentials. That is why it is termed as artificial intelligence. Like whatever the action or the functions, activities that are supposed to be carried out by the human being, where the machines are prepared and in absence or to replace some of the repetitive activities of the human, where this concept of artificial intelligence is useful, where we also need to understand like artificial intelligence used for both software and hardware. Hardware like example, robo, like concept of robo. The program is devised and then it is synchronized with the use of robo, where they carry out certain activities based on the commands that we give or inbuilt with our artificial intelligence services. And mainly when we look at the literature, artificial intelligence are used more often for analyzing large quantities of patient data, clinical data in healthcare services. I remember, the artificial intelligence, the concepts were, gaining it familiarity lost. In though it was the concept is there for even a decade and 2 decades ago, but the familiarity, the momentum started just 2 or 3 years back. 2 years back exactly, I can say. Again, this momentum got affected because of this COVID-19 pandemic. If the world was not affected by this COVID-19 pandemic for the last 2.5 years, definitely this artificial intelligence, the concepts would have been boom, and then there would have been many developmental activities would have been developed, and also even in the nursing profession also the concepts would have been well developed and tested by many researchers. So it is an evolving profession and evolving area, and where it is mainly helping to transform the healthcare from the traditional healthcare to more sophisticated advanced healthcare technology. And we nurses, we handling technology is not something new for us. like there is no much difference. We already handle many gadgets, many machines, mechanical ventilator, monitors, advanced cardiac monitors, right? So this artificial intelligence will be one step above, where they try to replace the human functioning. Like already we connect patients with machine, right? So this artificial intelligence, right, so even our support will be replaced with there will be a direct contact between the machines and then the patients, but it will be operated by the human being. So that is what the advancement the entire world is looking for. So in order to have a better artificial intelligence and its application in nursing, we all need to have a better understanding. So what is the concepts of artificial intelligence, how it can be utilized in a nursing practice, and most importantly, the nurses should be involved from the conceptualization, development, and even when it is implemented, what is the impact that is creating on the patient's care, because we are the one in charge, or the person responsible for developing the pattern concept of artificial intelligence applying for the nursing care. So mainly I believe the first speaker and would have highlighted about the technique, the beginning, like there are some concepts, machine learning and then NLP, all these are some technical words they use for developing, mainly to develop algorithm. So here mainly focus on the artificial intelligence is done on developing a algorithm with available data. So whatever the available data that is fed into the machine, this artificial intelligence technique will collate all the data and come to a conclusion, where the the integration of, or the joining of the intelligence that we man carry out on a daily basis. For example, diagnosis. These days the evidences says that artificial intelligence can read the scan report, and also analyze the the data that is fed into the system, and it can make diagnosis up to 99% accurate. It is also helping to analyze where exactly the cancer have developed, where even sometimes human can fail to do all these tasks. So that is the impact of artificial intelligence that is going to create in the days to come. So mainly artificial intelligence in nursing, so they try to reach these objectives. These are all the purposes that can be met, where it is going to help us in monitoring the population health, and also it can predict the best patient outcome that can happen during the care that is given to the patient, and which is also going to help us in administer treatment for patient care, and which will also help in identifying the appropriate evidence in pertaining to individual patients care and the clinical services. And how artificial intelligence used the present days, there are about 8 areas the literature says that decision making, like there are some clinical support, decision support tools that are available, right? So in the form of electronic health record. So once we feed all the data into the system, that will analyze and give the pattern of the diseases. This is this is the patient might likely to develop arrhythmia, the patient might likely to develop pulmonary edema, so it will direct a treatment to us, and direct a treatment in well advance. And as I already mentioned, it is also helping us with the process of diagnosis, and in fact early detection is well possible. They say that the artificial intelligence will collate all the information, including the genome analysis, the genetic factors, everything. It will put it together and give us a report where the patient can be identified in well advance. Rather, we don't allow the patient to go into advanced form of cancer. And even the previous speaker have highlighted about the end of life care, where robot can give physical care and also emotional support. I'll come back. I highlight in later part of my presentation. And AI is being used in artificial intelligence, are used in collecting the data. And many clinical trials, they use this help of artificial intelligence. And they also prepare more naturalistic simulations, like like almost like a patients. The simulators can talk to the students, so that we can have better training to the students, where some of the important concepts, like like highly complicated procedures, are not possible for the students to have experience in the clinical area, right? So for those complicated procedures can be conducted in the uh, college setup itself, when we have highly developed technology using artificial intelligence, having a simulation setup. And once we collect the data, the artificial intelligence can gather the data and also help us to make nursing decisions. So what is the nursing activity that I supposed to carry out for my patient? If suppose if the artificial intelligence is going to alert us, because they also say that alert system is available, like the machine will alert the patient may develop. Suppose the machine says the patient is going to develop pulmonary edema, right? So whatever the important nursing activities, it could be starting with diuretic administration, right? We know like what are all the sequence of nursing activities. So it is going to help us in planning our nursing care. And also these days there are a lot of apps and gadgets are available, like which analyzes the human health behavior. And even the nurses are also involving lots of research activities, developing more conducive app. So where like there are many nurse researchers, innovative nurse researcher. You look at, there are a lot of literature available. There are many trials are conducted in improving the health of the people. And the use of artificial intelligent nursing, like these are more practical. Like there are many trials, many evidences that are available, but very few areas where the concept of artificial intelligence in nursing is well used. One example is virtual reality simulations. I mean, I've been explaining about the usage, the current usage in the previous slide, where the nurse can, the nurses, the nurse educator can train the nurses to more an ideal situation. Almost, it is not possible to have a teaching and learning experience in the real life scenario where patient is having a cardiac arrest, right? Because everyone will be busy, everyone will be on their toe in implementing the activities position. Whereas if suppose we have high fidelity, well defined, well structured simulator, having artificial intelligence, where the patient, the simulator also can interact with us. So where the patients the real life scenario we are creating for our students, the better teaching and learning can be done in the teaching learning activity. And also robot assistants, right? Now the nurse, like during the pandemic, we would have seen in the mass media, like robots delivering some certain nursing activities, delivering a medicine, delivering food, like in the highly restricted or containment zone, especially in China. There are a lot of activities we have seen on the robot assistant. And artificial intelligent tools, right? This is also like again, I was listening to the first speaker. He was speaking about electronic medical records. So This artificial intelligence tool somewhere related to the electronic medical records, so where it will alert like some of the disease conditions or the complications that the patients may develop, or like based on collecting all the information like patient data, whatever we fed into the system, so where the machine can alert us, and accordingly the treatment can be given. So that is about the usage, current usage. And now we'll see what are all the certain evidences and appropriate examples that are currently existing with the concept of artificial intelligence in nursing. So there was a technique like a camera-based monitoring system. It was developed by the researchers in Netherlands, right? So initially, most of the patients uh, who go for cardiac surgery or any other major important surgery will be kept in the ICU only for the monitoring purpose, right? So nothing else. Otherwise, the patient will do well. So like we need to have one-to-one human ratio services for taking care of this patient. So they wanted to reduce such workload, and where they have developed a system with sensor based, where this camera is trying to monitor the patient's activity on the clinical, and it will also read the face reading and chest wall rise, and if at all if any changes in the patient, that is connected to the monitor, and the monitor will alert the nurse in the team and go and give a immediate attention. It is not necessary that always someone should stand there and monitor the patient vigilantly. Okay, so that is the concept of using camera, smart camera to monitor the patient. This is one example. And also the robot nurses, like when we talk about robot nurses, the Japan, they're in advance, they're inventing a lot of robot based health services. The main reason, shortage of nurses, and also they have more aged people, about 60 to 65 percentage of Japanese population are above 60 years, 65 years, right? So they help in delivering certain important tough nursing activity, shifting and transfer of the patient from wheelchair to bed, and from bed to wheelchair. And they also have the device called the robot called Robier, like a beer-shaped nursing robot who look after the personal needs of the patients, especially older age people, and like they need some assistance. Whatever they give comments, they listen and they give. For example, bring water bottle, they bring water bottle, and something like there are a lot of YouTube videos are available. Like I request all of you to have a look on it. And also like even Shajila highlighted about a robo called as Paro, right? So it is a companion for elderly people. In fact, they even their eye movements, like the soulful eye movements, they blink, they whisk, and they give the reply. They like most of the people, elderly people, they find it alone. Like most we all are in very busy working schedule. Home people would have gone for work, and whereas they find these people are a companion to them, and they were their emotional support to somehow met, at least not to the 100% where there is a presence of human being. And there is also medical robot, something called as Mabu, like where they talk to the human and they give reminders about their exercise activities or the medications, about their follow-up whenever the human failed to do so. So it is about 15-inch, and where they do engage with the patients, with a companion. Like the lonely people, they feel that there is somebody in the home, who's there to take care of them, who's there to talk to them, listen to their feelings. An autonomous robot. So this is what we have seen, more widely used in the hospital during the pandemic, like shifting the medicines, shifting the food, and which is also used for, shifting the medical supplies from one area to another area, and especially during the highly containment area, and where these robots carry the medicine, food, and they also give an alert to the patients to carry out certain activities. So they are also seen in practice. So whatever I bring this artificial intelligence, like what is already established, there are many things, but still there are trials are going, but these are some of techniques already which are well proven and which is effectively implemented by the healthcare professionals. And what are all other some of the evidences used, like telenursing, remote based care, right? So where the nurse gives the nurse or the healthcare professionals gives a command to the machine by using remote based control, and the robot does the activity with the patients, and which is mainly useful for hazardous clinical setup or highly contagious patients. So where it has some automated task which replaces the human involvement. And also there is a device. See, this is all research evidence. I've already given the handout to the organizer. You can collect this information, go in detail and study about the researches and how these artificial intelligence are impacting on nursing activities in detail. So there is a system they have developed which will monitor the need of catheterization, and also when to remove the catheter, when to change the catheter, if at all, if there is any signs and symptoms of urinary tract infection, that will alert, because these are something important nursing activities that we need to care for the patient during the sick, whenever the patient is admitted. And also there is a system that is developed preventing a fall with a vulnerable group of patients, those who are at the risk of falling down, and where the machine the artificial intelligence capture this data, and which will alert the nurses or healthcare professionals, where the nurses or other team members can give immediate attention and to go and save the patient and prevent a fall. And also like electronic medical records, right? So they just you all would have seen the movie which was directed by the Shankar, right? We have Robo Indiran. It was released in Tamil, where the Rajinikanth was the actor. Where the Robo can do thousands of work. Where almost 100% work can be done in 15 minutes of time, where human need more of so that is the concept, same concepts being used, where the artificial can
मॉर्निंग क्या
I
दो ही
kindly
खाया
request the participants to mute yourself.
Somebody is talking about chapatis. We know we are all hungry, but let Ramesh finish.
Yeah, I'll finish in time. I know we are
muted, ma'am.
beyond the schedule. We are beyond the schedule. I'll finish it, as early as possible, ma'am. Okay, like where the machine can read lot of data in, it saves the time, which is going to alert us what are all the important health concerns in the given area, where appropriate remedial measures can be implemented. And like when I looked at the literature, the applications of artificial intelligence technology are still under the development phase. We have not reached completely, well established techniques, because now, it comes for diagnostic purposes. For example, like, there is a well established intelligent concepts for diagnosing the cancer patient by reading a cancer reports or the documents whatever we feed into system. Likewise, we don't have well established system for nursing, because it requires a lot of intellectual input. The system we need to develop, we need to standardize it, and then we also need to check their efficacy. So we need to develop, well-established, high quality artificial intelligence based nursing delivery system. Like the first speaker would have told about machine learning, and then and then connecting the concepts, and they develop mainly algorithm for delivering the nursing care or whatever the concept. So such system need to be developed for nursing. So I think definitely these changes will happen in the days to come. Like, we'll let us wait and watch what are all the changes and development that might happen in another maybe 2 or 3 decades. Maybe definitely the things would have been different, will be different maybe after 20 years, 30 years, where there will be the artificial intelligence robot will lead a leap in the nursing care. So we may even expect the computerized robo receiving the patient in emergency, who can act as a triage nurse, who can analyze the patient condition. And there are also already trial, proven that robo can withdraw blood sample perfectly than the phlebotomist or the healthcare professionals. And they can also check the room availability, and they can sequence the treatment, and they can arrange the medicines, the medicine trolley, or whatever that is essential for saving the life of the patient. And in fact, even there was a discussion on it, where a robot beat healthcare professionals in the drawing a blood sample. Like, because the drawing a blood sample is important concern. There are many people fail like on a first prick. And even when we go for even experienced phlebotomists fail during the first prick. Think about the patient, those are in critical conditions, right? So these devices, the robo help us in avoiding such, because even there are complicated procedure can lead into phlebitis, other infections, and etc. So this will be one of the important addition to the healthcare services. And the improved data, like we find most of the time the human resources are documentation, and we find difficult and waste a lot of time in the health maintenance of patients, particularly into maintenance of data and preservation collection. There are a lot of changes going to come, like where the machine will collect the information, and meaning where there is a very minimal support. For example, like where the person will be reading out the minutes or the report, where the device will capture, and whatever the words that was captured by the machine will be automatically converted into text, and it goes and settles in the central storing system. Finally, we may have to just, however, it is a machine, we cannot directly put into, and there should be one person, if at all, if there are any errors, and that will save a lot of time for maintenance of data. And there is a lot of invention that is going to happen on electronic health records and electronic medical records in the days to come, where the nurse also will play a vital role in it, because we do have a lot of documents, electronic health records, electronic nursing records. So where we may need, we may see some of the important changes in the days to come. And optimized workload, of course, when there is robo assistant and a well established artificial intelligence guidelines, it is going to eventually decrease our workload and have better efficiency, and where the person or the nurses can spend more productive and more time for other care patient activities. And then which is also going to give a better treatment to the patients, and better solution to the patients, where we are not going to waste the time, because where human will take so much of time reading the multiple data information for coming into a conclusion. Whereas with the help of artificial intelligence, the faster diagnosis can be done and the treatment can be initiated. So that will result in better patient care and treatment. And there will be the visual recognition software, where it is going to change the healthcare, future healthcare delivery, where more clinical nursing services, or even in the critical care setup, this software can identify the problems with the patient. They can diagnose. They're going to alert the nurses to provide appropriate nursing care which is required. And to conclude, whatever we use the intelligence, we use a lot of technique, we use machine learning, data analytics, and then NLP, natural language processing. However, artificial intelligence can never replace the human resources completely. And and they can never almost, I can agree, maybe to some of the mechanical field or technical field, the artificial intelligence can replace the human human resources. When it is coming to nursing as concern, right, so artificial intelligence can never completely replace the nursing manpower. Of course, there are some assistant, robotic assistant, and which will lessen the workload of the nurses or the healthcare services, healthcare force. Because I had I seen one video. Even I was trying to get it and display it. It was a beautiful video, where the artificial intelligence developed robo was speaking to a human, and where there was a conversation. There was a conversation between a machine and a human. The man was asking, how are you, how do you do, and I heard you do cooking. I heard you wash the vessels, wash dressings, you speak to the people, and you give alert, and you remind such an activities. And what else, tell me, what is that you can't do it in the world? And immediately the robo replied. And the robo, which was prepared with the basis of artificial intelligence, replied that, yes, of course, I can do all the activities. I can do whatever the activities you tell, you give me command, I'll carry out. But only one thing which I fail to do, which I can't have, is that soul, right? The soul, the human touch can never be met by a machine. Where we nurses, we have a human touch. In fact, we talk to patient, we counsel patient, we comfort them, and all those can never be replaced by a machine. So also, like we need to have more solid evidences to see drastic changes in the artificial intelligence in relevant to clinical nursing practice. Let us see, wait and watch what is the world and the people going to bring us in the years to come. So thank you all very much for your patient listening. So that is all I have to share from my side. And if at all, if there is any question I would like to take up, and if possible, I try to answer them.
Anybody is having any questions? It is awesome lecture, sir. Really, every time we hear, we feel like hearing you all the time. This was a new aspect from your side, other than research, what we have heard. Thank you so much, sir. Really, as you said, that robots can do, that artificial intelligence can help in nursing, but they can't replace nursing because they don't have the human touch. It is rightly said, sir. And really, robots have no emotions, but there are no limitations also. And at the same time, whatever is fitted, they do that same thing. But somewhere where the new robots have been done for the old people, where they can give them little support, and that is really beneficial, because where human can't do, that robots can do it. Thank you so much, sir. Thank you so much. Ma'am, anything to be added?
No, thank you, Dr. Ramesh. It was an excellent presentation, an eye-opener for all of us, and the scope to start programs in AI nursing. I think we must all deem to be universities at least look at it and offer such courses, which will increase the employability of nurses in different settings than the routine ones, so that nurses will be trainers for the implementation of AI in nursing care, both in the education and the clinical sector. In education, we need to learn more about simulation and practice test scores, like which Shachila madam was saying, because your 12th marks, your entrance exam marks, and your performance every year is also an AI measure to measure your academic growth. That is what I was told by my friend Joanne, the Dean of the TJU College of Nursing. And so many things to do. We need to collaborate, and excellent presentation. I think we must start doing more about this, otherwise we will be left behind. Thank you so
Yes.
much.
Yes, ma'am. Thank you very much, ma'am, for always recognizing me and giving me an opportunity to be associated with KLE INS. It's my pleasure, and thank you all, and have a good day. Thank you very much.
Sir, one more thing I would like to add. All the time we disturb you, you are always available.
No, it's not.
Thank you so much,
No,
sir. You are always.
I'm sorry. Actually, we're supposed to have this earlier, but due to
No,
some
sir.
problem,
Even we were busy with the NAC, so it was
yeah.
postponed.
No, we waited for you, Dr. Ramesh and Shajala, because we do not have any resource persons talking about this topic in India. Like I myself am not capable of talking about this topic because I'm not well versed with it. So we were waiting for both of you to
Thank you, ma'am.
coordinate the things, and thank you so much.
Whatever I spoke, with the available, documents. But however, as you said, we can think about having collaborative, courses, ma'am, like artificial intelligence courses, like, certificate courses. Maybe your team
Yes.
and then the team
Yes.
from here can start to, we can have a kind of a brainstorming session and think about it. We can even
Yes,
give a
yes.
collaborative certificate courses, which is offered
Yes.
by, because in fact, which is the goal of the recent revised NEP given by the
Yes.
MHRD. So we
Yes.
can think about it. Thank you, ma'am. Thank you very much.
Thank you.
Have a
Thank
good
you,
day.
ma'am. Thank you, sir. Thank you to all the resource person. Thank you, Ravi, sir. Thank you, Sijila, ma'am. Thank you, Ramesh, sir. Thank you, Sudha, ma'am, for giving us this opportunity, especially for the DONE. And thank you to the whole college faculty for participating, helping us. Thank you so much, sir.
Thank you, ma'am.
Thank you for all the participants. I can see
Yes.
Ganga Bhavani, Gayatri, Aji, many of my friends, Pushpalata here. Thank you so much for joining us, all the participants. Raman ma'am, so many of you across India. Thank you so much.
They are given the compliments to Sudha ma'am on all the resource persons also, like Ashwini ma'am and Dr. Taya ma'am Joseph. She has told thank you for, and sir, it was a wonderful presentation also. It's been told by one of the delegates.
My pleasure, ma'am. Thank you. Thank you very much. Looking forward to collaborate in the future activities also. And hope we'll actually collaborate. Thank you.
Thank you, ma'am and sir. It was really a wonderful session. We really learned a lot from this session. I think I have just first session about AI, and this was really amazing. Thank you so much.
Raman.
Yes, sir. Ramandeep from SDT University.
Yes, Raman.
Yeah.
Anybody else?
I was just sharing that it was a wonderful session. We really enjoyed a lot, and this was the first time I attended some AI session. So I was very curious about this. So I really learned a lot, and if the things were taken in such a perfect way, I would really love to read more about this now.
Yes, thank you.
Thank you so much. Yeah.
Thank you.
The whole credit goes to the principal, ma'am, for suggesting these topics. Yes.
I think we all are a team. We learn from each other.
Yeah, that's
And I was just going through the chats of Praveena, Dr. Vanaja, and Prajakta, pilots from nursing team for successful AI pilot projects. So I think we must do these pilot projects across India.
yes.
Thank you.
And we
Thank
have
you, ma'am.
to
Thank you, sir.
think about the certificate courses, joining certificate courses, and artificial
Yes,
intelligence.
yes,
Think about
yes.
I'll speak
Yeah, we'll do
to
it.
I'll speak to Nalini ma'am and
Please
explore
speak. I'm ready
what.
for it. Any other university wants to join in can join in. We will do some AI certificate course in AI.
Yeah, yeah.
And
The certificate course can be certified by 3 university with 3 logos.
yeah,
So in fact, that will be a great addition. At least the concept, a knowledge-based course, you can think about it.
yes, yes. Because the other day my dental dean was presenting in the academic council. They have started AI in dentistry, one certificate course. So,
Okay.
and they have a lot of resource people, good resource people from India and abroad. I think we can look at it and work on
Yeah,
it.
again,
So,
even we can look for abroad collaborators with some
yes,
foreign
yes,
university.
yes.
So we'll work on it. Thank you, ma'am. Thank you.
Thank you. Thank
May
you
I
so
take a leave now?
much.
Yes, sir.
Okay. Okay. Thank you. Thank you, ma'am.
So all the delegates, thank you so much. You all can fill the feedback form and your certificates will be available. Only the 100 certificates will be issued per day. So kindly bear with us and whatever issues are there, you all can put it in the WhatsApp chat. Okay, thank you so much for bearing with us and being in time. We were just little ahead of time, so but we have done it. Thank you so much. So the further the webinars and workshops will be notified shortly through your mails. Thank you so much.
May I add something, please?
Yes, yes, ma'am.
Yeah, I would like to say thanks to Sudha ma'am for taking up this topic and organizing a webinar on this topic. Thank you so
So
much, ma'am.
yeah, thank you so much, ma'am. Ma'am has just logged off, but I'll convey this message to her. Thank you so much, ma'am.
Thank you. Thank you so much. Thank you.
Okay, can we leave? Everybody can log out.